So good afternoon, everyone. Okay, maybe you didn't grow up in the same tradition as me, you have to say. All right, so we're gonna try that one more time. Good afternoon, everyone. Good afternoon. See how easy that is? That's awesome. I am so delighted to be here. My name is Reed Melton. I am the Vice President for Clinical Affairs, Clinical Operations at the Blue Cross and Blue Shield Association. Our tent is right across the way if you'd like to join us. I am so delighted to be here to introduce this amazing session, and this wonderful panel is they're really the star attractions. I'm just the warm-up act here. And really delighted to have this conversation move forward and talk about the critical junction that we find ourselves in 2022, where we have an opportunity to look at the intersections of healthcare, technology, and also equity. We've had a lot of conversations around equity, and in particular health equity already this week. So delighted to see that proceed. Specifically, we want to look at how technology continues to influence healthcare and how we can leverage healthcare and the innovations in healthcare to be intentional about shaping the outcomes that we'd like to see so that everyone has the ability to have equal opportunity for long and healthy lives. And in particular, as we look at the US today, in the situation we find ourselves in one particular example that we find very poignant and we talk about a lot, and that is that in the US we have the highest maternal death rate of any developed country. That's staggering, right? Quite staggering. But we have an opportunity to do something about it. Those numbers are driven mostly by disproportionately for women of color. You see that the numbers are higher as it relates to women of color. And as we look at it, it's not limited by the boundaries of education levels, socioeconomic status, age, or even geography. So that's a statistic, though, that we absolutely have an opportunity to turn around. It is staggering to me, and to everyone else in the room, I'm sure, that this leads to women of color being 2 to 3 times more likely to have a complication during pregnancy or during birth. And those are things that we can address. So how are we going to do that? How are we going to leverage technology to change that statistic? And that's what the panel will get into today. As innovators, as leaders, it is our responsibility to look at statistics like those and to do something about it. And so I'm very excited to hear how this panel is going to address leveraging technology to address health disparities and change that particular statistic to one that's much more positive and much more favorable for the US. I am very delighted to have the opportunity to introduce our moderator for this session, and an amazing moderator she will be, Katie Dresser, who is the CEO of rockhealth.org. So without further ado, I am very delighted to turn the session over to you.
Awesome. Thank you. Thank you, Reed. All right, everyone can hear me. We've got a group of experts on this panel, but I know there are a lot of experts in this room. So through the course of the next hour and then afterwards, like I guarantee you, I know half of you in this room, if you turn next to someone near you, I guarantee they're a digital health entrepreneur. We roll deep here at Aspen Ideas Health, or some sort of innovator in digital health. So just to say, there's us, but this is all of us together. So we're gonna have an exciting forward-looking conversation, a little sober too, about the future of digital health. I think in this moment, the pandemic the last couple of years has dramatically accelerated innovation and inequities in this space. What are we gonna do about it? I'd love to see a show of hands. Who here has ever used a digital health app or seen a provider? Yeah. Okay, so that rate of adoption and acceleration is way faster than we thought it was gonna be a few years ago. I was in this tent a few years ago. Those hands were not raised. This has happened dramatically. And so what we're gonna do is kind of look ahead what's next. And I'm joined by, just the most amazing group of people. I said we'd have a sober conversation. Let me also ask you all, who here, if over the last 2 years you have felt a bit more optimistic about what technology can do to enable care? Raise your hand. For those not raising your hand, I hope you have questions for when we come out to you towards the end of the session. So, all right, we're gonna dive in. Let me introduce these ladies. They have really impressive bios. I encourage you to look them up, learn all about them. So I'll be a bit briefer. It would not be possible to like actually do them full justice. But Catherine Cooper is a partner at Jumpstart Nova, where she brings an history of operationalizing change and making astute early-stage investments in the healthcare arena, founder of Health Tech DEI, and just like, go read her bio. This woman is extremely qualified for the job. Dr. Monique Smith, she's an emergency physician at Grady. She also runs the, let me get this right, the Health Design ED, the Acute Care Design and Innovation Center in the Department of Emergency Medicine at Emory. And she has an awesome background in design for digital health and health equity that I hope she brings to this. And then Dr. Megan Rainey, who we saw on the opening stage, academic dean at Brown University School of Public Health, founding director of Brown's Center for Digital Health, and professor of medicine at Brown's Medical School. She did tell me the other day, she's like, I have a very big team, because I was like, how do you possibly do all these things? So a ton of relevant experience to bring to bear to this. So let's jump in. I'm going to start with you, Catherine.
Sure.
You have a history of seeing beyond the horizon, so I would love to hear from you. What do you see? What worries you? What excites you? What are you seeing as next?
Big question. What is this? We're in the.
Good luck.
Yeah, it was like the future of digital health. A lot of future stuff. A lot of crystal balls going on. You know, the little purple emoji is what I think of right now. But jokes aside, so I think what we're seeing is an incredible adoption of digital health technologies within folks that thought that they would never use them. A lot of that was accelerated by the pandemic. For some folks, they couldn't go into the hospital, and it was safer for them to get their care at home. And I hope that's something that continues, that will serve rural populations well. People who, you know, even for myself, do I want to drive, park, and go in for a 15-minute appointment, or do I want to sit in my house and schedule this between my Zoom calls? Like, I would rather do the latter. So I'm seeing an incredible adoption among digital health from the venture capital perspective, to steal a little bit of what we talked about on the panel that I was before, which is also futuristic. Venture capital predicts the future, in fact, is that we're seeing a lot of investors that are not necessarily dedicated healthcare investors enter the investment realm within healthcare, and specifically focusing on digital health. From a domain expertise perspective, it may be a little bit easier to handle and kind of dabble in. And so I hope that's something that continues into the future, and that wasn't only driven by, you know, we can't invest in consumer, so let's look at healthcare because we're in the pandemic. I think that capital allocation, and specifically the direction of capital within to entrepreneurs and healthcare startups, is the strongest way to move the needle in terms of healthcare innovation. And so that's something I'm excited about. I think on the flip side, you asked me something that I'm, you know, kind of a little thumbs down about, so to speak. And I'll say from the point of this increased interest, excitement, and perhaps awareness of DEI challenges as it comes to healthcare, both in the distribution of capital, who gets funded, and then also healthcare outcomes themselves. What I'm not excited about is the expectation that these underrepresented communities are the single folks who can solve that problem. So I am an investor at Jumpstart Nova. We focus on Black-founded and led healthcare companies. I will say that, and then folks will ask me like, oh, so you guys are health equity investors. And we're not. We may invest in health equity solutions, but the idea that by saying that we're investing in this particular underinvested and underrepresented group, that means those founders are also solving health equity problems, is a challenge and a, I think, mental connection that people make immediately, and they should really reflect and think about why they do that. Because in fact, all problems can solve problems for all people, and sometimes it's an extra burden to ask those people who are oppressed to also solve the problems for their communities. Sometimes they're best equipped to solve them, but I think we shouldn't make that assumption. And so I am, I guess, thumbs down in that sort of continuing on to the future, and I hope it corrects itself.
Appreciate the caution. I think it's a wise word. Monique, talk to us about where design in healthcare is going. I think you and I both agree there's a lot of hype, but in the ever-evolving pandemic, we don't really have time for the hype. We need to actually look at pragmatic solutions, untapped opportunities, et cetera. So what are you seeing in your work?
First of all, Katie, I always love how you frame questions. First of all, you very purposely said healthcare. And a lot of what we think about is that digital health is something that's powering healthcare, right? Whether that's the brick and mortar we've been doing for centuries, whether that's hybrid, whether that's virtual. I'm an emergency doc. I work in a healthcare system that spans 5 hospitals across Metro Atlanta. And Atlanta's not just hot, it's also diverse, right? And so when you think about that, when I walk into work, I'm either looking at a 45-year-old woman, a Black executive, coming from Delta. Next, door, I've got another 25-year-old Uber driver, white male, working in the film industry as well. Maybe I've got a 77-year-old white female who came from rural Georgia, family drove her in, she's grandma, right? Those are very diverse end users. And when you think about that in the digital health space, somehow that gets lost, right? And so there's this large untapped opportunity, as we all know, that's out there, where we're thinking about the 7 out of 10 of Americans who haven't been designed for, not only in healthcare, but even more specifically now in digital health. We're failing them on 2 ends and creating a problematic situation, right? And so when you think about that, I'm a huge believer in what the opportunity is and what we can do in terms of not just personalized medicine, but AI and machine learning, but we gotta ground that in the way that we're actually providing care. I'll give you an example, right? And so in the beginning of the pandemic, we were thinking a lot about how we think about the sick, not sick. Megan will get this as a fellow emergency doc. And part of that is sometimes the vital signs you see in a person. And that fundamentally determines the entire trajectory of their care based on what I see in that first glance and that piece of information. So we have the opportunity to partner with our bioinformatics core, using essentially AI as well as facial recognition software to think through how do we think about temperature, how do we think about your oxygen levels, how you're breathing. And this is all being done on your face and your skin color. And so imagine you need a training set that's pretty diverse. We're an academic institution. My colleagues were happy to put it out in the ECO and say, hey, we don't have a diverse enough training data set. Let's see what we can do as a community to put something out there that we can all use, right? So imagine my shock and my chagrin, Catherine, I know you've sat in the seat before, when a few months later, someone came to my door, said, hey, we've got this great technology for your emergency department. You're able to predict vital signs with facial recognition software. I was like, great. How did you validate it? What was your approach to the training data set? I've seen this problem before. Absolute crickets, right? And that's what we see across healthcare. And we see that in multiple ways. Where one, we didn't design intentionally in the first place, not human-centered, not community-based, none of that, didn't even think about it. And then we tried to imagine that there would be mass adoption because we're just gonna push it on everybody, right? It doesn't work that way. And so we're all shocked that digital health, in this next decade, hasn't been adopted. But all that comes back to design and intentional design. And that's where I believe the future is. That's where I think we have the real opportunity.
That's awesome. Megan, over to you. You're training the next generation of digital health entrepreneurs and innovators. What are you seeing? What's inspiring you? What are you hearing from them? Not just like who's technologically savvy, but are you finding moral imagination and other kinds of much needed traits in the next generation?
Absolutely. So one of the joys of being at a place like Brown is that I work with everyone from undergraduates through medical students, through master's students, through PhD students, plus my residents and fellow physicians, nurses, the entire care spectrum, right? And so each of them brings their own perspective. One of the things that I have found transformed over the last few years is that 5 or 6 years ago, I was having people come to me saying, I have this technology, I'm a computer science major, I really want to kind of use this technology and think about how to apply it to health. Instead now, I'm finding people who are doing ethics, economics, sociology, music, who are coming and are interested in working in how to design digital health for the next generation. There's a really different approach to what it is that digital health consists of, what are the questions that we have to ask in designing it, and then how do we evaluate it and make sure that it actually works on a population level. I'll say one thing that, although I'm an emergency physician and care deeply about the individual, I also care a lot about populations. So one of the things that many of the students that have been working with me have been focusing on is how do you create digital health solutions that may not ever need you to not only not cross the door of my emergency department, but not ever cross the door of any healthcare facility whatsoever. How do we provide empowerment to folks that are out in the community, in the place where they live? How do you work with corporations? How do you work with schools or with libraries to develop things that you might not even think of as digital health, but that help to link people to those services that are so foundational, that are the structural determinants of whether or not someone is healthy or not. And I'm gonna give one example. We just had our first ever pitch competition, and the winning team was co-designed by a student who had worked with me since his undergrad days. He then took up a couple of years to actually work at a health design firm, came back, finished his MD, is now going on to a residency in primary care. and by one of our primary care docs and his team at our hospital system. And it's a program to help link, and I'm looking, I see there are folks in the audience that I knew are doing similar work, but to help link patients to social service agencies at the point of care so that they don't have to go out and search for the next step and kind of where to go, right? We don't just hand them a paper printout from our electronic medical record at the point when they leave, but rather that you're actually actively linking them and then doing the reverse. So that when folks are encountering social service agencies, community groups, nonprofits, how do you use that point of care access to folks who might not otherwise be touching the healthcare system to provide basic healthcare education? So there's just this really different perspective on what digital health even consists of, and then what are those basic equity and ethics and privacy questions that we need to be grappling with that I have seen really change over the last few years, and it gives me tremendous hope for the future.
It's coming from the students.
It's coming from the students. Oh yeah. The students come up with stuff all the time that I'm like, oh my God, that's so brilliant, right? Yeah. What about if we designed this differently? What about if we had a way for caregivers to alert us if their family member needs help? What about if we have a large South Asian community in Rhode Island? What about if we worked with our South Asian community centers to try to translate this and create culturally appropriate imagery that could work in this community that's largely underserved? Like, that's awesome. Let me empower you to go out and do that, right?
Yeah. We're seeing a lot of that. And you know, it's interesting. I think digital health stands out to me in the tech sector more broadly, the VC sector of like, who's actually innovating in this space? I have great hope that actually those questions will keep getting asked and not be like, oh, forgotten about when markets get tight, like maybe today. And I think if you know half of them are in this room, like innovators in this space, there is that deep commitment, and I just hope we stay committed to that over time. I have hope that we will, but that gives me more hope. I think building on sort of leadership, you know, Catherine, you work with so many entrepreneurs, and you're building this big table as an investor, and you know, the future is only as bright as some of the entrepreneurs in it. And what would it look like, and what are you seeing? What's your advice on not just how folks of color, low income, you know, disabled folks of all kinds of backgrounds can enter, but also stay in this space, stay innovating, be supported and sustained over time? What are you seeing?
So I'll give a very, I guess, kind of brief answer, and don't let the fact that I'm Kurt mean that this, I haven't thought about this problem. But the short answer is to invest in these entrepreneurs. Kind of just full stop, period, the end. Capital and things.
That does deserve a round of applause.
Yeah, I joked with my husband that I wasn't going to say full stop on this panel. It doesn't land in all audiences. The Melton conference, it was just stray crickets, and I was like, all right.
We got you.
I was like, the average age here is like, 75. Not here, but there. But jokes aside, to encourage folks of these communities to remain entrepreneurs and continue to innovate, continue to have successful companies that will then have successful exits, but more importantly, while they are building those digital health companies, will have an impact on the patient populations that they serve that may reflect them, may reflect others. They need capital. And so there are fantastic entrepreneurs out there who have bootstrapped their companies and are not dependent on outside funding. Maybe they're going the kind of non-dilutive capital, NIH, SBIR, STTR grant route. Maybe they're looking at foundations. Maybe they're self-funded. But for those that are going to the private markets, and I'll only speak to VC because that's my domain expertise, we need to fund them, and we need to fund them at higher rates than they're currently being funded. So less than 2% of funding goes to female-founded companies. Less than 1% of VC funding goes to Black-founded companies. I don't have the stats on people with disabilities or LGBTQ or the spectrum of what we call diversity in terms of the entrepreneurship space. But if you're looking at a 97% to 3% capital allocation differential, the answer is to invest. And in order for these entrepreneurs to succeed, they need money at every stage. And that will not only encourage other folks like them to get into the space, because you're seeing those ahead of you continue to
Succeed.
Yeah, not only continue to succeed, but if you're seeing them as they are now, going to a point and then hitting roadblocks, you may say, that seems interesting, but I'd actually just rather work for a big company, or I'd rather do something else. That seems like maybe it, not to say is too hard, but I don't see folks like myself succeeding in the space, and that's a little bit discouraging. So I would like it to switch to be encouraging, and that they see them succeed, as you said, and be
the
funded.
money plays a big role.
Oh, I mean, what is it? Money talks, like.
Says the investor.
Sorry, but money moves the needle when you have a company. Ask any of the entrepreneurs who some of whom I see in the audience and know, and other people who I hope to know. You would like to pitch people, and you would like to close that pre-seed, seed, Series A, et cetera, round.
And you quoted on the last panel, the VC panel, you quoted a Rock Health study that 46% of the funding that flowed to entrepreneurs last year was to new founders. That's unusual. That again, it's encouraging, but is it going to sustain? How much? There was a disproportionate amount of capital going to white men in particular, right? So
so that's.
But the fact that many new entrepreneurs.
We can get excited about the new entrepreneurs, right? We can look right now. We can look at the graph is up. But what does the graph look like in 2013, 2023, whatever. No one caught that. 2024. But that actually raises a good point. When you when we dolly back from the graph and don't just look at these last couple years and the years past. What has it looked like for the founders that you just brought up in the question, and what will it continue to look like? Because if I were to just guess and make a graph with my hand, it would just look like other founders, them. And so when we're talking about basis points in terms of capital allocation of 1% moves to 1.2, and then the next year 1.5. These are incremental changes, and I'm saying that yes, they are positive, but I want to recognize where they are from a macro view perspective. And so I really believe that investing in these founders with money is the most important. I think that mentorship, office hours, cohorts, all these things are beneficial. But when I say investment, I mean investment with dollars.
Amen. Monique, I want you to bring us back into the hospital setting. I think of a hospital as fairly chaotic. But what do you see? Can you tell us one innovation you're seeing happening, playing out in the hospital that maybe we don't know about?
Absolutely. I think for me, the chaos of the hospital is actually very organized. What is very chaotic is the lived experience of people when they bring that to the hospital. So I'll give you an example, and one of our founders are actually in the audience, right? Nutrable. It's a fantastic new digital health platform. And what they're doing is they're allowing me as an emergency provider to prescribe well-being, right? Can you imagine, rather than having to write you a script for your blood pressure medicine or your diabetes, I can actually do something that matters around your diet. And I do it in a way that's connected in terms of who you are, realizing that we're all different people, right? You might live in a different zip code with different access to different supermarkets with fresh food, vegetables, and also different cultural base for that, right? And so being able to do that in a way that's virtually enabled, that also allows that to be paid for in a way that's not placed the burden on the patient is something that's fundamental. And it makes it easy and seamless for me as a physician. Now that changes things. That's an upstream, tackling something that's coming to bear in a hospital system in the midst of the chaos, in the midst of lived experience, and really responding to it in a way that is very nuanced and also intentional. And that's where really good design comes in.
Awesome. This is very funny. We have two ER docs on the panel who are in digital health and really changing the system from within. Megan, what's one question you wish more people would ask you, or you wish they knew about digital health as an ER doc?
I love that. So the first thing is to know to ask ER docs. I'm a little bit biased here, but we are the entrepreneurs of the healthcare system because we have to be. Because we work in low-resourced, 24/7, a little bit chaotic settings, and we are constantly MacGyvering our way through healthcare. And so we are often the leaders and the thinkers, and we can identify the pain points and the opportunities for change. The other thing, so that's the first point, is just to ask us. There are a lot of folks with really, really smart ideas that get at these kind of foundational problems with the healthcare system that make it inefficient, unpleasant, sometimes almost inhumane, that we're seeing firsthand. The other thing that I wish that people would ask us is, would you use this? Because I spend a lot of time looking at digital health, and I will say the vast majority of programs out there are things that would be nearly impossible to integrate into my clinical practice. And if I, as an early adopter, am not willing or able to do that, you'd better believe that my colleagues who are we have 50 patients in the waiting room, I have no ICU beds, My nurses are not, right, we're understaffed in terms of nursing. My charge nurse is like losing her cool, and so I'm trying to go and help her so that, right, I'm not gonna go and learn a new system, log into something else, remember that I heard about this app for this one condition one time, right? And so to think about kind of, would we actually use it? And then if not us, who? And that's the last part, is if we're not the ones who are gonna use it, we can identify who in the system, either the healthcare system or the larger community in which we are embedded, who would be the person that would be able to use this and champion it and make it a part of their daily life in a way that empowers people and keeps them out of our doors.
So
Which is ultimately our goal, right? Like, we don't actually want people coming to the ED. So
No, thank you.
it's kind of, yeah.
So we've been at the investors table, we've been inside the hospital. Megan, sticking with you for a second, I want to touch on regulatory and policy stuff, particularly privacy. You just wrote an article recently about some of the undercurrents shifting privacy in this space. Can you give us a little foreshadowing as we think ahead to the future of what we need to think about? Yes, broadly policy-wise, but more specifically along issues related to privacy.
Thank you. So I'll say kind of for anyone in the field who is kind of part of policy, I think there's two big parts. So one is making sure that there are standards for evidence, which is part of the reason that many docs and nurses will not use digital health, is because we don't have any data that it helps, right? So that's the first part. But the second part is thinking about that ethics and privacy. And the piece that I just wrote for CNN was about privacy with period apps in the post-Roe v. Wade world, right? And then realizing that it's actually not even about the period apps, it's also about the data that we're putting into Google Calendar or into Apple Health, right? That we are all tracking things in all kinds of ways that, in theory, could be subpoenaed. And we are all used to the fact that big companies own all our data. If we're on Facebook or TikTok, or we have our Apple Watch, or whatever it is, we have a Gmail account. People are constantly tracking us, and we almost don't give it a second thought. But when it comes to health, I would argue that we have a different level of standard, of ethical responsibility. And to those that are developers, although HIPAA does not apply to you, I would urge you to take HIPAA as a floor rather than as a ceiling, about thinking about how do you protect patients' privacy, what safeguards do you put in place to allow patients to know what data is being shared with whom, knowing that most of us don't actually care. You and I had this discussion the other day. Most of us don't care all that much, but there may be some things that we feel very sensitive about, especially once these algorithms start getting applied, once you think about kind of where it could go out into the larger world and not knowing kind of what the next steps are. So I think there's a huge opportunity in the policy world, and then also for each of us who are involved in this, to think critically about what are those ethics of how we're consenting, how we're using data, which third-party folks are we sharing data with, and how do we empower our consumers to use that in a way that feels right to them, because otherwise people will, turn away from it.
Unless you two have anything to add to that, I have another question before I come out to all of you. But anything
You guys
want
might
to
have,
say?
I'll bet you both have thoughts on that.
I don't know. I think you said it really well.
Okay.
I don't want to I don't muddle it. It was perfect.
So I've heard Monique talk about revolutionizing healthcare vis-a-vis digital health, and so this is for both of you. No pressure. Again, I'm just asking you all the big questions. How would you define that? When you say that, what is that new lens you're thinking about? What does that revolution look like?
So that's equitable technology-enabled care for me, right? Often we think about the next gadget, the next thing, but we don't think about the for who and the for what, and what the adoption and what everything downstream of that looks like, right? And so if we're truly going to revolutionize things, we've got to look at the people who are using healthcare the most, right? How do we solve for their complex problems? Because if we can solve for that, we've solved for everybody, right? And that's when the revolution really begins. And part of that, as well as thinking about all the societal structures and pieces that are around that, the lived experiences, the things that we aren't solving for at all when people actually come into hospitals. I heard a great definition earlier this week around access, right? Where it's not the hospital, it's not the clinic, but it's actually the things that we do outside of that, where people live, right? Maybe it's the grocery store, maybe it's the way you get to and from places, maybe it's your safety, maybe it's any range of those things. So if we're not designing for that in healthcare, in digital health, then we're not going to revolutionize anything. We're simply just going to recreate what we have right now, which isn't going to get us anywhere. It's not going to make patients happier. It's not going to get us better outcomes. And we're certainly going to be stuck in systems that now have multiple layers that, frankly, could be more frustrating, right?
Yeah.
And so we've got to design for that.
Yeah. What'd you add?
Oh, I'm I was happy with her taking the question. I thought it was fantastic. I think sometimes you don't need to sprinkle other sprinkles onto something that's perfect. We don't need to.
That's how I feel like when I talk to Catherine.
Yeah, I was like, we don't need to mess this up. We're excited to take questions from the audience. We want to hear
Rainbow
from you.
sprinkles up here. Okay. Mike has the mic, and he will hand it to anyone who has a question. So let's see. You right there with the glasses on your head.
Thanks so much. We've talked a lot about the investor table and hospitals, but what's the role of community-based organizations and how they're involved? Just for reference, I worked at the YMCA for 5 years. Yay. So I was there when we were implementing the diabetes prevention program, and bidirectional referrals is very hard. You know, community-based organizations get the information, they can't necessarily share it back, and the majority of people live in communities. They don't live in healthcare systems.
And
so what's the role of CBOs in all of this?
So I will say, I actually think that, so if you heard my big idea yesterday at 3:30, it was really about kind of the fact that everything that we do in health has to be done as communities and together. And so I'll say at Brown, we actually have a large initiative that we're just launching with the communities of Providence, Pawtucket, and Central Falls, which are 3 of our core cities in Rhode Island, working with a number of our local community-based organizations to co-design solutions to reduce or very ambitiously eliminate maternal and child health disparities over the next 8 years in our state. We're a state of 1.1 million. We have the potential to do this. But we see this as being, this has to be done not hand in hand with, but led by the folks that are actually having the lived experience, and done in a way that the same way I want people to ask me as an emergency physician, would you use this? I want to ask the same thing of a community-based organization. Because you guys are, right, you are constantly fundraising, making budget, trying to do your annual reports, and most of all, trying to serve the folks around you. And any solution that we create and should be, it's not about digital health, it's about making health easier. And so are there things that we can co-design that actually serve, and this is my public health view, right, like that serve your needs, that help you do a better job to be more present for your community? To me, that is the goal. And I'm gonna give you one really short example. So I sit on the board of our local Nonviolence Institute, which is a program that has folks that have been victims of violence, have managed to escape from the cycle of retaliatory violence. They come into our hospitals after someone is shot or stabbed, and help to both help the victim, but also help the family, help the community to reduce the cycle of retaliatory violence, and then provide a suite of services around them. I've been working with them for about a decade, and about 2 years ago, I was like, we really need to update our data infrastructure, and what if I help you create an app so that our street workers who go out and kind of meet with all the kids and the parents and the, in the community can do these screens that we're trying to do automatically. And they were like, Megan, thanks so much, but that is the last thing we need right now, right? And so instead, we're actually working on a different project instead to help the teens in the communities where violence is happening to be more resilient, kind of, and to manage their own kind of conflict resolution. But that was a co-design process. It was not me imposing on them, but them kind of coming to me and having that trusted relationship that allows that to move forwards.
And to add to that, I think that's something that we're seeing in a post-COVID world, right? COVID created this great little bubble where all of these different sectors finally started mixing, right? So you had government, you had small minority-owned businesses, you had faith-based organizations with big healthcare systems that always had community outreach arms to these folks. But for some reason, it wasn't until COVID that they were actually dedicating their dollars in a connected community of care model to actually create influence. And that influence being around COVID, making sure people understood what prevention was, what vaccination was, and understanding how to navigate this pandemic. And so one of the learnings that we have from that, and this is part of the future and the acceleration that I hope to see, is that we take that, right? And we take that in the way that Megan's talked about, that aspect of co-design, where it's now not just this push and pull, but we're actually all maintaining that space and that ecosystem to then to create these sort of equitable technology-enabled care interventions, right? So we're thinking about this in a totally different way.
And then we need people to fund it.
Yeah.
So
Here we are.
There we go.
He's ready. He's ready. All right. You had your first hand up right there with Mike, this guy in the black T-shirt. Yeah.
Yeah, thanks for that. Dr. Rainey, you mentioned the evidence base. I think in the area of AI and ML, the evidence base is so rapidly evolving. I'd love to hear from the docs, and then to the extent that you're seeing that in some of the funding targets that you are funding, how are you thinking about that? And as a founder of an AI ML company, I'd love to know how you guys are thinking about that.
I do just want to plug that Rock Health published an article today about the clinical outcomes against all these digital health innovations, and it's a little bleak.
We're all Googling.
But I would encourage you to look it up. But yeah, over to you all.
Do you want to answer first, or do you?
Yeah, I'll hop in on that. So, whenever I see an AI ML-based technology come my way, my first question is always the same. How have you validated that, and how do you plan on iterating on that? I don't expect you to get it right the first time around, but I do expect you to have a plan of how you're going to get it right? Like I said, they're a diverse set of end users, and when we're thinking about creating algorithms that are determining how we think about things, how we care, we've got to be really careful there, right? Because we can't replicate our already broken systems and just layer technology on top of that to make it easier. It doesn't make it easier for anyone. It just makes worse outcomes and creates another layer of, frankly, bureaucracy.
I will echo that, and I will just double down on the external validation. So many of the things that I see are fit beautifully to whatever model, right? They developed it with one group of users, one system, and so that external validation, we have seen it over and over and over, where something looks like, the greatest thing since sliced bread, and then you go out and trial it in a different system, and it doesn't work. I also think that the other thing, kind of as healthcare providers, that won't matter as much to the general community is this kind of black box aspect that we want to understand how and why, and so kind of being able to explain that at least to a modicum of satisfaction is important.
From my perspective, my assumption is, I believe the founders who are pitching it to me believe that it works, and I don't have a great way. I'm not an AI, ML expert to determine that if that is in fact true. So when in doubt, phone a friend. So usually my first go-to is to clinicians and to ask, when presented with a solution like this, do you think this would work as well as what you are currently doing? And then what are the questions that you would ask, that you would dive into, which I think both of these physicians explained. And then if that's going to be used in a hospital or healthcare setting, for us, a lot of our strategic limited partners are medical schools, hospitals, health systems, major insurers. We kind of go to them and say, would this type of solution be something you would want to implement at scale? And if so, what are the risks there? And what are you, seeing, concerned about, or have questions for? And then we would kind of bring those back to the founders and kind of start a dialogue.
Thank you.
Yeah.
You're welcome.
Right behind you, Mike.
Hi, thanks so much. Ram Dixit, I'm a human factors engineer at MedStar Health. We're a large healthcare system in the DMV area. I have a question. So first off, I want to say, big believer in digital health. Thanks, everyone for speaking. But as somebody who's kind of struggled a lot with digital health implementation in our healthcare system, I wanted to get your take on some of the pain points that I've felt. Two of the main kind of cultural problems that I see are kind of money and mindset. So, money, I think, fairly straightforward. There's just not much of it for digital health at our healthcare system. Mindset, I think, a little more complex, where folks just, it seems like we're all still trying to operate on this fax machine model of healthcare, and we're trying to shove digital health in there. And that really seems to me like a major rate limiting factor to like any of this innovation actually kind of having a useful effect. So I wish I had a more
That's awesome.
optimistic
That's a great
question, but curious to hear your thoughts. Thank you.
So can I actually, at the beginning of COVID, when we had no tests, period, right? But the very few people that I could get, I had to kind of call my department, actually fax a form to the Department of Health to get permission to do a test. Then we would send the test out, and then we would wait for a fax back with
PTSD,
the result.
Megan. Why'd you bring that up?
So to the point that we're a fax-based system, 100%. So your question, I think the three of us will probably take it in slightly different directions. For me, this is actually part of why so much of the space where I think about digital health is actually outside of the healthcare system. Because we are, the stats about it's 18 years from discovery to implementation, right? The fact that all of our healthcare systems are on the thinnest of margins right now. All of our staff, nurses, techs, physicians, social workers are completely burnt out and cannot possibly imagine adding anything extra. And tech to us has been largely a little bit of a pain in the neck rather than a boon. And so you've got a perfect storm for reasons that implementing digital health in the healthcare system is really, and plus there's Epic. So, Which, like, everyone's like, well, I put all this money into Epic, so if it's not part of Epic, why would I spend more money on it, right? So to me, actually, digital health, the best solutions for digital health, the ones that are going to transform the system, are actually going to be outside of the healthcare system. And I think to your revolutionizing, it is about reimagining where do we find people, where do we deliver care, where do we empower people that may put me, I don't think ER docs are ever going to be out of a job, but like maybe will put us at least partly out of a job. Like I want it somewhere else. Because I don't actually think, I'm sorry, and I work in a large healthcare system, I don't think that we are the places, with a couple of small exceptions, Northwell being one of them, right, but most large healthcare systems are not places that are set up to innovate.
Certainly echo every bit of what you just said. I think the other piece is how do you win hearts and minds, right? When you're inside the system, my job is to figure out, well, how do I align your incentives? Like, it's no shock. Healthcare is a business. A hospital wants to make money. Right now, part of the reason margins are thin are that, not only are we having, crises in workforce, but people are seeking their care elsewhere. That's a problem. That's a problem that digital health can help us solve. So rather than pushing that way as, implementation is bad, this is bad, how do we find new opportunities, new pockets that we haven't thought of as a system? And so the work is actually in bringing that to bear and telling that story really well, and telling it so that the incentives, the money, and the people then all follow, right? And that's also a little bit of the design work, right? Because then you've got to start early in that process of understanding that story, carrying it through and as you build the product or service, and then also then selling it back again and again, iteratively, because it doesn't happen once, it happens every single day.
Oh, sorry, I was like, I don't necessarily believe everybody has to answer every question. And we have 5 minutes left, and there's some more people who had questions. So I will abstain.
I'm gonna come to you in a second. One last question. This very eager hand right there. Yes. And then I'm coming back to you.
Hey, I'm Buck. I really appreciate everything that you had to say. Had the opportunity to work on a lot of cool policies in Congress in both the House and the Senate. And I feel like the pandemic has almost given us like a paradigm shift in the acceptance of digital health, whereas you were talking, Monique, about the generations that you deal with in different settings. Some of those generations may have been more skeptical of adopting either on the practicing side or the receiving end of digital health. And then going into the privacy conversation, I mean, the Energy and Commerce Committee is having a privacy debate literally today and voting on a new privacy bill. I guess my question is, do you think that there is also a paradigm shift in, like, as my generation ages, being more comfortable knowing that more of your information is voluntarily being handed over to companies that could potentially utilize it for a lot of very good things to help clinical outcomes, but could also use it for their own profit incentive?
I like to remind people that millennials have turned 40. So they are actually receiving care. They're not just getting their Uber, they're showing up in my emergency department. So that shift has happened, whether or not we're recognizing it or not. I mean, I'm gonna be like Catherine, just keep it short and sweet.
Yeah, I mean, you're not wrong. So, I feel like we experienced the peak of Uber and Lyft back when it was cheap. It was awesome. And they had town cars. Anyway, but you had another question, or we're doing another audience one?
All right, so we're gonna end with a little bit of action, because us entrepreneurs don't like just the talk. So what is a piece of advice you have, some action that the audience, that we can all take together for a more equitable digital health future? Whoever wants to go first.
I'll go for it. I think we need to lead with reparative innovation, right? We have seen that societal structures have really made it very, very difficult for some people to have, the best well-being that they can, right? So when we all start tackling that collectively from whatever sector we're in, that all impacts health at the end of the day, right? I think we need to shift our gaze a little bit upstream, because that's where that starts. That's it.
So mine is, I love that. Sprinkles. And so I actually think of equity, this would be my takeaway, is to think of equity in multiple domains. So there is absolutely equity around race, ethnicity, country of origin. There's also equity around socioeconomic status. There's equity around where you live. If you live on the south side of Chicago, if you live in rural Indiana, you are not going to have broadband and you are not going to have Wi-Fi. There's certainly equity around age, and yes, we are seeing increasing adoption from older adults, and we can have a whole different discussion about why we should not write off older adults as being ripe for digital health innovation, but you have to think about it a little bit differently. And lastly, there is equity according to disability or variable ability status. All of us are going to live with a disability at some point in our lives, and people who are currently living with a disability are approximately 20 to 40% less likely to have a laptop or to have access to dependable broadband, never mind visual or hearing impairments or other type things that can impair. And so my urge would be to think about equity across each of those domains. You can't tackle all of them at once, but to know that there are steps to be taken in each of those to help create a more just and equitable digital health ecosystem.
That's hard to follow, but I'll add some very different sprinkles. I'll speak from my, I guess, investor hat, which is really the only hat I've got, and do a little bit of a, I'm going to say self-plug, but I'm a big fan of academia, education, and your own personal reflection on facts and data sources that are out there. So I wanted to point you to one. I and some colleagues wrote this report. We also, my colleague, Dr. Espinoza and myself, founded a company called Health Tech DEI, which is to capitalize on the wealth of diversity. And it's specifically around for capital allocators, so venture capital, private equity, et cetera, to how they look at DEI in the allocation of capital. We focus specifically with healthcare clients. We work with the California Healthcare Foundation and now the American Medical Association. But we wrote a report back in 2020, and I'm going to flub the name of the report that I actually wrote. It's long. It's like identifying evidence-based strategies in the funding of diverse health tech founders. But you can find it on, it's literally healthtechdei.com. So go there, download it. It's free. It's a couple pages. Read it. And it's on identifying evidence-based strategies. We've got some clinicians here, and so as an academic myself, I love evidence and actual facts, and strategies that have supported the increase of funding of Black, Latinx, and female founders within health tech. And so you can read that report, reflect on it, and think about where you play in some of those strategies that are outlined in the report. What you can do to help, what you can do differently, what you can keep doubling down on, because we've got a very diverse audience, whether it's entrepreneurs, capital and allocators, clinicians, those who run organizations, community organizations, et cetera. And I think they all play a role in that.
I'm going to take the liberty of adding one, which is get to know digital health innovators. They have incredible stories. They enter into this space from a lot of lived experience or a pain point. They're also just like wildly creative and imaginative and have giant hearts because you'd go do something else that's far easier than this. But you can start doing that at 5:30 or 6 p.m. at the Hotel Jerome, where there's going to be some storytelling from some digital health entrepreneurs. So I want to give a huge round of applause to these three ladies.